Well, good evening, everyone, and welcome to Community Healthcare's Health Heroes Recognition Party. We're glad you all joined us this evening. We've got a lot of things going on tonight. You are going to learn about some amazing people and what they've done for our community. It's important to note that in the 2 years that we've been honoring health heroes, Community Healthcare has identified 60 individuals and organizations who are making Pierce County a healthier place to work and to live. We hope you'll visit our website and follow us on social media to learn about all of our health heroes. Tonight, we hold the spotlight up on 6 of these deserving honorees. You'll find out how community healthcare is rising to the challenge caused by the pandemic. You'll also be given an opportunity to support community healthcare in its efforts to provide healthcare services. Let's take a moment to thank the sponsors of tonight's event. We cannot do it without them, and we've got a lot of them. Thank you to AmeriGroup, U.S. Bank, MultiCare, Kaiser Permanente, Molina Healthcare, United Healthcare, Tucci & Sons, Pediatrics Northwest, our friends at Brown & Brown Insurance, Community Health Plan of Washington, LabCorp, Kurt Jacobson, Tacoma Community College Foundation, Pierce County Dental Society, Pierce County Medical Society, Wilson Albers, Reach Ministries, Tacoma Community House, Clover Park Technical College, Willie Stewart, Key Bank, Juanita Goldman, Hilltop Action Coalition, our friends at St. Vincent de Paul, CHI Franciscan Health, Imedia, also PNTA and Seattle Live Studios, and our friends at Host Event Planning. How about a virtual round of applause for all of our amazing sponsors and supporters? Of course, it is heartbreaking to see what is happening right now. So many people are struggling. Kids in school, businesses, and parents all trying to find a way through this pandemic. Community healthcare continues to be a place where people can access healthcare services and find assistance locating other needed safety net services. Times like these are why we have organizations like Community Healthcare. Can you imagine the calamity if community healthcare was not in Pierce County? If community healthcare keeps each of its uninsured patients out of the emergency room just once in a year, the community saves over $6 million, not to mention the benefit to patients who are not thrust into medical debt, but instead receive the care they need. This allows them to be better parents, employees, and neighbors too. At Community Healthcare, no one is denied care due to the inability to pay. However, being healthy does take more than access to healthcare services. People need housing, food, financial literacy, safe neighborhoods, and employment. Health heroes are those individuals working to make those things happen. It is now my pleasure to introduce Jim Walton, former city manager for the city of Tacoma and one of the founders of Community Healthcare.
Good evening. I want to thank you for helping us honor some of the many health heroes in our community this evening. As Martin Luther King Jr. said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. That is why I am proud of my 50-year involvement with this organization that works to provide healthcare services for all citizens who live in Pierce County. Every day, the staff of the Community Healthcare helped individuals cope with the effect of systemic racism. Even here in Tacoma, the lifespan of poor minority individuals is years less than their more affluent neighbor, even though they live only a few miles apart. Pregnant African American women die at a higher rate than their white counterparts. The same is true for their children. The board, the management team, and staff recognizes that systemic racism and exclusion exist in the nation as a whole and the healthcare system that's in place. In our clinics, we see the impact racism has on African American communities. Community healthcare stands with Black Lives Matter against racial injustice and inequality. And we believe that systemic racism and exclusion represents a public health crisis that negatively impact the lives and health of communities of color and indigenous populations, of LGBTQIA plus people, of women, of immigrants, and other marginalized populations. Diversity, equity, and inclusion are cornerstone principles that guide community healthcare in its mission, vision, values, and utmost overarching goals, and to provide the highest quality healthcare with compassion and accessible services to all. The Board of Directors, the management team, and staff ask everyone to join them in taking steps to identify and dismantle systemic racism in the community, to review their attitudes about race and microaggressions, and to fully recognize the promise and the moral imperative contained in the principles of diversity, equity, and inclusion. Thank you.
Thank you, Jim Walton, for those very important words. You know, I would also like to acknowledge that we are on the land of the first people of Tacoma, the Puyallup people. The Puyallup tribe plays a big part in our community while continuing to preserve and honor their ancient heritage. Now I'd like to welcome David Flenge, President and CEO of Community Healthcare. He has served in this role for 25 years. His leadership has led the organization through significant growth and through many challenges as well. When he started in 1995, Community Healthcare served 11,397 patients. In 2019, Community Healthcare served over 49,000 patients. That's over 400% growth. This speaks so much about his vision for the organization and for his leadership. It also shows the enormous community need for accessible healthcare. In addition to building bigger clinics and expanding staff to serve more patients, there have also been new programs. This includes residency programs for physicians, dentists, nurse practitioners, and pharmacists, and a new school-based health center in the Bethel School District. We will meet recent graduates from the Physician Residency Program and the ARNP Residency Program later tonight. David will give us an update on how community healthcare is responding to the pandemic. After David, you'll hear from Marco Viniegra, the board chair of Community Healthcare, who will give us an abbreviated history of the organization. Now, it also needs to be noted that Marco is a patient. One of the requirements of being a federally qualified health center is that at least 51% of the board are patients or the parents' guardians of a patient. This keeps the organization focused on meeting the needs of those it serves.
Thank you, Jeff. At the start of the pandemic, Community Healthcare was asked by the Tacoma-Pierce County Health Department to be an integral part of the community response. To meet this need, 2 clinics started serving COVID positive and suspect patients only. 2 served non-COVID patients only, and 1 served both types of patients. Dental and medical care was mostly limited to telehealth and urgent need visits, and in-person visits were used only when they were absolutely needed. Insurance enrollment, patient registration, and behavioral health was only offered via telehealth. In addition, Community Healthcare began providing care at 2 homeless shelters that were started by Catholic Community Services in partnership with Tacoma-Pierce County Health Department for high-risk and geriatric homeless patients to reduce their exposure to COVID-19. Community Healthcare also started offering COVID drive-through testing to the community at clinic sites. Fortunately, the federal response provided several $1 million in support to help pay for additional expenses caused by the pandemic. Funding was also received from the Arcora Foundation, Kaiser Permanente Foundation, and the FCC. This funding helped pay for expenses, expand telehealth capacity, and make our dental clinics safer for patients receiving care. The staff is increasing well child checks and immunizations, even though school is mostly online. The flu season will soon be upon us, and we will be prepared for our 49,000 patients to be immunized. Telehealth care is continually being expanded, and in-person patient services are increasing as the pandemic allows. Now I would like to introduce to you Marco Viniegra, our board chairman.
Thank you, David. In case you don't know, community healthcare was started in 1969, when community leaders came together to meet the needs of people who could not access necessary healthcare. The driving force behind this effort was Dr. George Tambara. For the first 10 years, they operated as two volunteer-run clinics. One was in a school in Salesian, and one was in the basement of the Nurses' Convent at St. Joseph's Hospital. To keep these two clinics running took a community. Hospitals donated supplies and prescriptions. The Pierce County Medical Society helped recruit volunteer physicians, and the Boy Scouts made sandwiches for volunteers. The list goes on. This success is an example of how communities can pull together people and resources to make a positive impact on the life of their neighbors. Our communities are facing great challenges with the pandemic, structural racism, and many others. The story of community healthcare gives me great hope for the future. It is a living example of how communities can overcome and succeed.
Thank you, Marco, and thank you, David. Before I move on here, I do want to take a quick check. I know we are doing some fundraising tonight as well, and we are already well over $28,000 thanks to your support. Thank you so much. Again, thank you to David, and thank you to Marco. It is amazing what community healthcare does, and it's because of support from people like you. It offers the best quality healthcare possible to anyone who needs it. In addition to medical and dental care, it also includes substance abuse, behavioral health, insurance enrollment, connection to other community services, pharmacy, and maternity services. In 2019, the physicians of community healthcare delivered 528 babies. How about that? Now it is time to recognize some of our health heroes. We'll start at the Kimmy and George Tanbera MD Health Center, located in Salishan, where Tanya Campbell, Community Healthcare's CFO, will introduce our first honoree. This clinic was one of Community Healthcare's first two clinics and was started in a Quonset hut in Salishan. After that, it was in Lister Elementary School and then a community center. When the community center was torn down to rebuild Salishan, the community rallied and raised funds for a new clinic. Next, we'll travel to the Hilltop Regional Health Center that serves the downtown Tacoma community. The Hilltop Regional Health Center replaced an older clinic that served only about 2,000 patients a year. The new health center serves over 25,000 patients a year with medical, dental, and behavioral health services. It's also home to Community Healthcare's interdisciplinary family practice residency. I want to add that the Key Bank Foundation has also provided funding for PPE to keep staff and patients safe during this pandemic.
The Health Advocates of Salishan are residents of Salishan that have been focused on improving the health of their neighbors since 2007. They take community input and build resources and programming that provides needed support. They have a full understanding of health disparities and provide comprehensive supportive services. The key to their success is that they are experts in providing culturally appropriate services to all the cultures represented by the residents of Salishan. This program started in 2007 when Salishan residents were recruited to help health department researchers collect community feedback. They continue to gather their neighbors together to get them involved in health education, exercise, developing food solutions, and civic engagement. Salishan residents represent over 40 cultures, all ages and backgrounds. The Community Health Advocates Group is reflective of these demographics. They are a bridge between the institutions which serve Salishan, which are often distrusted, and the community. They mentor and support the institutions to make changes to help them better serve residents. They are also mentor and support residents to advocate for themselves for more changes. The community health advocates help residents access health care, food, education, community resources, and insurance enrollment.
On behalf of the Foundation and the Salishan Community Health Advocates, I want to thank you for this award. This project was in direct response to feedback from Salishan residents. They asked for community gardens, cooking classes, and peer support, or neighbors helping neighbors. From the very beginning of the program, residents and community health advocates were equal partners in the design, implementation, and evaluation of their efforts and the impact on the neighborhood. The overarching goal of this program was to train residents to educate, equip, and support Salishan neighbors to improve their health. Leadership was the cornerstone of the program, with CHAs leading their own projects and leading each other. They became important partners with the Tacoma Housing Authority, the Salishan Association, Community Health Care, the Tacoma Pierce County Health Department, and the UW School of Nursing to address health challenges in the community. We learned so much about how to develop a cohesive, multicultural, multi-generational team that became a model for community health, team building, and leadership development and community involvement. Thank you.
Thank you, April Black, for the nomination of this outstanding organization, and to Jeff for your comments. I would now like to introduce Community Healthcare's own Dental Director, Dr. Jeff Reynolds, who will introduce our next honoree.
Thank you. Dr. Bayer recognizes the inherent injustice in poor quality health care for those without stable housing, employment, or health literacy. He addresses this through his work with community health care. His philosophy towards his profession is one of service and dedication to those most in need. Born and raised in Pierce County, Dr. Bayer has made an intentional commitment to the community that formed him, taking an active role in the well-being of those who need reliable, consistent care most of all. He further expands upon this by sharing his time, talents, and experiences with others in the dental field, serving as a mentor to newer members of the profession. Outside of the dentist chair, Dr. Bayer is active in supporting those overcoming the challenging struggles of addiction, shares his musical talents, and has spent years cultivating appreciation of the natural world with Pierce County youth and adults alike. Pierce County and her citizens are healthier for Dr. Bayer's heroism. Dr. Bayer was nominated by Ariana Hadari.
Thank you so much for this recognition. I'd like to thank Dr. Reynolds, Amy Merritt, and the entire dental team, all of whom give themselves to our patients every day. I am no more deserving of this recognition than they are. Self-sacrifice, compassion, and caring are the components of HERO. In healthcare, all of us are called to that every day, albeit on some days we're better than other days, being human. A true hero to me is a single parent with children working 2 jobs and doing their best to make life better for their kids against the odds. They sacrifice everything for them. I believe service to others without judgment or strings, without broadcasting what we do, is a vital part of the meaningful life that we all have the opportunity to live. Thank you for all that you do.
Thank you, Dr. Bayer, for your comments. It's great having you on our dental team. Next is Kimberly Sales, ARNP. She provides care here at the Hilltop Medical Clinic, and she is the program director for our nurse practitioner residency. Each year, 2 nurse practitioners residents learn and work with the physician residents to become better practitioners.
Thank you, Dr. Reynolds. I would be remiss if I did not mention that Dr. Reynolds is also the program director of Community Healthcare's dental residency program here, with a partnership with Lutheran Medical Services that trains 2 dental residents each year. Community Healthcare's Teaching Health Center here at the Hilltop Regional Health Center is one of the first interdisciplinary residencies in the country. It is my privilege to honor Prentice Johnson. Prentice has been active in the Hilltop community for a very long time. He is the proud pastor of Greater Christ Temple Church, and he also serves on the Tacoma Ministerial Alliance as secretary. Mr. Johnson serves on the Behavioral Health committee where their focus is breaking the conspiracy of silence regarding mental illness in the African American community. Prentice is also the executive manager of Mr. Max Men's Clothing Store, serving as a volunteer. You may know that Mr. Max Men's Clothing Store has been an institution on the Hilltop for many years. It is now owned by the Tacoma Ministerial Alliance to provide financial support for a youth scholarship program and incentive for high school students to stay in school through their partnership with the Elizabeth Wesley Incentive Program. Prentice also serves on the Carol Milgart and Common Spirit Health in Action Project Steering Committee as a volunteer. That's where I met him. The focus here is on supporting and representing the faith community as an advocate for healthy living for our communities of color. In addition, Mr. Johnson serves on the Pacific Lutheran University Alumni Board of Directors and has done so for the last 10 years. And he is currently the co-founder and chancellor of Greater Christ Temple Church Agape Bible College. This school was established in 2017. It is a degree program and is a campus of Midwest Theological College and Midwest Theological University. Prentice retired from the Boeing Company in December of 2015 after over 37 years of dedicated service. While at Boeing, he received several accolades and honors for community service. Mr. Johnson has served as the chair of the Shared Service Group Diversity Council and Engagement Team, which was founded in 2002. And because of his work, he was the recipient of the Global Diversity Process Improvement Award in 2005 and the Diversity Change Agent Award in 2007. Prentice was nominated to be a community healthcare health hero by Jeanette Evans Kimball. Please help me congratulate Prentice Johnson.
Thank you, Kimberly. First of all, I want to really give honor to God for my life, for my health and strength. I was born a child that had a heart condition, but in that heart condition, I've learned over the years that God has been my blessing, my strength, my power, and my grace. So whatever I do and all the volunteer work that I've done it to give Him the glory. I want to also thank my mother and also thank my wife, but most of all, I want to thank the health community care that have done a great job in the community over the 50 years here in the Tacoma area. And I want to thank all of my co-workers and all the people that have given me the opportunity to do work when it comes to volunteerism. I've been in Tacoma for over 65 years, born here in Tacoma, raised in Tacoma in the Hilltop area. And the one thing I always wanted to do was give back to this community. And I believe that that's what we all should do. For this award, I humbly receive it, and I thank God for it, but I want to see others of you as well volunteering in this community to make our better Tacoma area, as well as Pierce County, a better place to live in. Eradicating homelessness, making sure that all people are created equally, and that all things are done well in this community, joining one together as one, lifting up the name of Jesus Christ. Thank you very much, and I appreciate all that have given to me, and all I want to do is do more for this community. Whether it's Mr. Mack, whether it's the young people, whether it's the homelessness, whether it's mental illnesses and mental conditions and health care, that's what it's all about. So I encourage all of you to do the same. Volunteer your time, give back to the community, and let's give God the glory and the praise in all that we do. Thank you very much.
Wow, how about a big virtual round of applause? So many amazing heroes in our community. And I'm looking at the live chat right here. Now would be a great time for you to do a chat of your own to congratulate those heroes that we just heard about. And of course, many of you are supporting our heroes by making donations as well. And I'm looking here, we're up over $31,000 already tonight, and you can be a part of it. comhealth.org/hero gift if you'd like to make a donation. All right, again, thank you, Dr. Reynolds, Dr. Baer, Prentice, and Kimberly. Man, truly inspiring stories. And this is what makes a community a place that you want to live. People who give of themselves and work to make things better. Very few of us have opportunities to change the world, but all of us can make our corner of the world a better place. Aesop may have said it best: no act of kindness, no matter how small, is ever wasted. Have you ever noticed how something as simple as a kind word can make such a difference? Well, next up is a video about how community healthcare and the staff of Stability Clinic is making a difference. Vicki Grimes, ARNP, is a graduate of the ARNP residency program and grew up in the Hilltop neighborhood. Community Healthcare's ARNP residency program was one of the first in the nation. This will be followed by a virtual tour of the Hilltop Regional Health Center by Dr. Jeff Smith, Chief Medical Officer.
If you have to worry about the basics, like where am I going to lay my head? What am I going to eat? There's no room for healthcare, because why would I worry about my blood pressure when I don't even know where my next meal is coming from? So when the pandemic hit, Community Healthcare partnered with the Tacoma Health Department and Catholic Community Service and figured out a way to reduce barriers to care for our homeless population. And it was then that they came up with the idea of having a stability clinic. It's a trailer that provides full spectrum primary care. Realizing that there are multiple things that create barriers for people to access care, the trailer actually goes to where the individual is. Care on the trailer is actually an avenue to actually getting people established to primary care. It allows me to build trust first, and then once that they see that they have a trusting relationship with the medical provider, then they don't mind going to the clinic. So it's served as a great avenue. I think one of the things that I appreciate about community health care is that they actually provide access to all, and that's with or without health insurance. And so I have patients who don't have health insurance, which means that sometimes I have medications that I prescribe or that they need and they can't get from the pharmacy. But we do have a patient fund that allows them to pick up a medication that they don't have money for, and it's free of charge to them. Well, one thing that actually drew me to the mission of community health care is that it's desire to give good care to everyone, accessible and affordable care to everyone. I've always said that community health care, in my mind, is a community within a community. Probably one of the only jobs I've ever had where I've just felt like it's a family, and that the care actually starts inside the building. It's really beautiful, actually. It's a blessing.
Thank you, Vicki. Hi, I'm Dr. Jeff Smith, and I'm the Chief Medical Officer at Community Healthcare. I've worked here for about 24 years, and Community Healthcare has been in existence for 51 years, serving the needs of the Pierce County community and greater Tacoma area. Here we are at the Hilltop Regional Health Center, and I'm going to show you and give you a brief virtual tour and show you some of the changes that we've made in response to the pandemic and actions that we've taken to try to increase people's safety here. So we're starting at the dental clinic. That's where we're at, and we're going to show you some of the changes that we've made here. We got a grant from the Arcora Foundation to help fund some of these things, and you can see one of them here is a tent, which we have isolation rooms where we're doing procedures that have aerosolization and potential spread of the virus. We put them in there. We have a very cool air filtration and suction system that removes the waste to the outside. We have some of the things like here that are open bays where we will do exams that don't have any aerosolization or contamination. The patients can sit there with the doctors and get things taken care of. And then we have private rooms where if there are things that are happening like these rooms here, we can close the door and the patients can have complete privacy there. So now we are on the other side of the third floor where we have our adult medicine clinic. We have 4 programs located here. 1 is internal medicine, where we take care of adults. 2 is our Ryan White program, where we take care of HIV infected individuals, as well as primary care, behavioral health, and pharmacy needs for them. Third program is our gender affirming care program. And the fourth program here is our Vietnamese speaking clinic. The Everyone's Clinic was closed recently, and we took over care of those patients and are continuing to serve the need of that community here while we search for Vietnamese speaking staff to better serve their needs. So this is our second floor, which is our family medicine clinic and family medicine residency. As you can see, we've installed plexiglass dividers between the patients and the staff and between each of the staff, as well as adequate social distance spacing in the waiting room. We also have a supply closet full of PPE, which was in short supply at the beginning of the pandemic, but which we've been able to resupply given our federal grants as well as other funding and support from the community. So here on the second floor, we have our family medicine residency, where we train young physicians to do family medicine full scope, including obstetrics, pediatrics, geriatrics, adult medicine, substance abuse, behavioral health, and we have a pharmacy residency, and we have a nurse practitioner residency, which make us unique in our 4 interwoven, interconnected residencies in community medicine. One of the things I like best about working at community healthcare is our ability to take care of all of our patients regardless of ability to pay, insured or uninsured. For example, the last patient that I saw today was a 45-year-old woman who has rheumatoid arthritis and a bad liver. It's very difficult to find proper treatment for her, to find consultation services, particularly if you don't have the ability to pay with insurance. However, we have volunteer physicians who come to community healthcare, and our volunteer rheumatologist sees her and helps me manage her very difficult case. Another example that happened today as well was I saw a 4-year well child check on a patient that I delivered. But the fun part of that story isn't just delivering her and caring for her for those 4 years, it's that I delivered her mother 24 years ago, and I've taken care of her mother her whole life and her entire family for 24 years. Those are fun interactions that benefit the community and make me happy about working here. This is the first floor of our building where we have our urgent care, which has been turned into our COVID clinic. That way we can facilitate separation between our COVID positive or COVID screened patients and everyone who's healthy coming here. We have the Buzz, which is currently closed, also due to COVID, but that is a Goodwill-run training center for barista training center for at-risk youth. We have our pharmacy, we have a community room, we have a bank of outreach workers who are here to assist patients in finding insurances, and we have a wall that shows pictures of our founding fathers. Community Healthcare founded 51 years ago as a community health center, basically to meet a need in the community. It was founded by community physician George Tambera, as well as another group of the founders, in partnership with St. Joseph Hospital. One of our first 2 clinics is located in the basement at St. Joseph's, and for the first 2 years they had the practice there before moving the clinic to the Tacoma-Pierce County Health Department, and then eventually set up as a community health center at the start of the community health center movement. And that concludes our tour of the Community Healthcare Hilltop Clinic, where we have our family medicine residency and the other programs that I showed you. I did neglect to show you our providers doing telehealth visits on computers and telephones, and our drive-through clinic, which happens out in the parking lot where we do drive-through screening for COVID. But I did want to take the opportunity to emphasize again how important your support is for community healthcare. The support of the community and financial support of individuals allows us to do the work that we all are here to do. Our mission at community healthcare is to provide the highest quality healthcare to all, and your donations help us to do that. So thank you for watching, thank you for participating, and I hope thank you for giving.
Wow, community healthcare is quite the place, isn't it? Well, thank you, Dr. Smith and Vicki, for the work that you and your staff do. Community healthcare not only provides essential healthcare services, but they continually adapt to the times to make sure that their impact is felt where it is needed the most. I can't help but wonder what their more than 49,000 patients would do if community healthcare was not a part of our community. And here is your chance to be a part of their story. All of us need healthcare, and unfortunately, many go without. Please consider the impact you can have right here, right now, on the lives of real people in our community. There are simply not enough healthcare resources to meet every need, especially for those who are uninsured or even underinsured. And we need your support today. To give, it's very simple. Visit comhealth.org/HeroGift. comhealth.org/HeroGift. Your donations are going to make a difference here. We're already up over $34,000. You can be a part of this amazing work that's going on. Right now, it is time to honor our final 3 health heroes. We'll start at the Lakewood Clinic. Community Health Care has served the Lakewood community since 1987. This clinic was first in a community center, but moved into the former Lakewood City Hall when the community center became unavailable. This allowed for the addition of expanded medical and dental care. At the Lakewood Clinic, the presenter is Dr. Margot Chan. She is a recent graduate of the Physician Residency Program and has chosen to stay at Community Health Care. After the Lakewood Clinic, we'll go to the Parkland Clinic and then the Spanaway Clinic. The Spanaway Clinic is one of 2 clinics in the Spanaway area. The other is a school-based health center in Bethel Middle School. Like the Stability Clinic, this is another way to make healthcare accessible by taking it to those who need it.
Thank you, Jeff. I'm honored to recognize the Titan Food Pantry on the campus of Tacoma Community College, which provides food and connection to community resources for students struggling with food insecurity. This organization and its champions were nominated by Bill Ryberg. Titan Food Pantry was the initiative of former TCC students Ashley Go and Meilani Soli, who developed the initial business plan based on their research. They surveyed 1,000 fellow students to assess the burden of food insecurity on campus. Of the students surveyed, they found that 40% said they've had to skip meals to make food and finances last for the week or month. 74% said that hunger or lack of food had caused them not to perform as well in their studies. Another 54% said that they have 2 meals or fewer per day, with 9% only having 1 meal a day. That's approximately 1,300 students trying to make do with only a single daily meal. Perhaps most concerning is the 36% that is considered stopping college altogether to secure employment in order to provide household resources like food. Let that sink in for a moment. Over 1/3 of the surveyed students thought of quitting school because they did not have enough to eat. With Ashley and Meilani's plans, the Key Bank Foundation agreed to fund a pilot project and launch the food pantry. Thanks to a gift of financial support from TCC Foundation board members Max and Margie Harned, the Titan Food Pantry continues operation today as the Max and Margie Harned Titan Food Pantry. Its impact would also not be possible without the generous financial support of Tina Hagedorn and the hard work of Food Pantry Manager Ben McLean, who is here to accept this Community Healthcare Health Heroes Award.
Thank you. I humbly accept this award on behalf of all those who made it possible. One of the pleasures I enjoy about my job is interacting with students on a daily basis, trying to encourage them and let them know that life struggles happen, but the food pantry is here to support them and also to reinforce the Maslow's theory of hierarchy that unless our basic needs are met, how can we succeed and thrive in life? So I want to thank the president of the college, Dr. Ivan Harrell. I'd like to thank the foundation and all those who made this possible once again. Thank you.
Thank you, Ben, for your comments. It's now my pleasure to introduce Dr. Blair Campbell, who provides care at our Parkland Clinic.
I am honored to present the Health Heroes Award to Ed Wolfer and Virginia Gaub. They started a food bank at their church. Described by their pastors as diligent and faithful leaders, workers, organizers, facilitators of many volunteers, patient servants for our brothers and sisters seeking food. They serve through the Jackson Street Food Bank, a joint venture of St. Andrew's Episcopal Church and Temple Bethel, part of Nourish Pierce County Food Bank Network. They are heroic in their humble and generous service to our community. They engage our clients to serve with us, that together we may help one another and model the sense of community that our society desperately needs today. They were nominated by Pastor Martin Yabra.
Hi, I'm Ed Wolfer, the coordinator of the Jackson Street Food Bank. I'd like to say thank you to St. Andrew's Episcopal Church, to Temple Beth El, to Nourish Pierce County, to the Emergency Food Network, all the people that have helped us out. The Diocese of Olympia and the Episcopal Church, who gave us a grant for our freezer and our refrigerator, and all our clients and all our volunteers. Thank you very much.
Hello, I'm Virginia Gaub, and it's my pleasure to be helping Ed Wolfer with the Jackson Street Food Bank for about the last 15 years. We have a lot of wonderful volunteers, and I help to coordinate those and order the food from the various sources. I want to thank Community Healthcare for honoring us with this Health Heroes Award, and it's been a surprise and a pleasure. Thank you very much.
Thank you, Ed and Virginia, for your work to improve our community. I would like now to introduce my colleague, Dr. Sandra Werner, who is the lead medical provider at the Spanaway Clinic.
Thank you, Dr. Campbell, Ed, and Virginia. It is a pleasure to recognize Norman Brickhouse as the manager of Goodwill Center and For Strong Families. Norman brought his 25 plus years of experience in the for-profit mortgage industry to his passion in the nonprofit service sector and those needing financial stability and self-sufficiency. In just over 3 years, he brought many programs and partnerships to not just Goodwill, but to the community, completing nearly 900 free taxes in just 1 year to people making less than $54K annually. Partnered with Valeo Vocation, providing employment and financial education to those experiencing homelessness and home ownership classes for those who had only dreamed of owning a home. Norman has nominated by 8 individuals. Each of them had something wonderful to say about Norman. Those statements include: Norman is very charismatic and truly has a passion for helping people succeed. Norman has truly been an asset to many people in Pierce County below poverty level in many aspects of creating financial stability. Norman has a special gift on making dreams attainable. Norman Brickhouse is a hero to the nonprofit world. Time and time again, he has been there for countless people and their families to help them not only to get financially stable, but accomplish their dreams. And last, one nominator summed it up best. He is amazing. Thank you for all who nominated Norman.
First of all, thank you so much. Thank you, Community Healthcare. Gosh, not for just this award, but for your sponsorship with our Hire 253 events, with so much that you do in the community. This is truly an honor. Thank you to everyone that nominated me, specifically Anastasia, because you called me and told me I won the award because I didn't know. Since leaving Goodwill, where I was the manager of the financial education department, first of all, thank you to Kelly Blucher, my wife, who's the outreach manager, Heather Little, who's now the manager there. I've left Goodwill, but I'm still family there. I'm now the director of Valeo Vocation of Mission Services, where we're a nonprofit staffing agency and we simply make dreams come true. We help people attain housing. I still do financial coaching. We do employment services through our BFET program. We partner with the YMCA and the health department to do showers. We work with the stability site, helping people reduce their barriers, attain employment. It's through this great work that I get to meet some of the best people. So quite frankly, this is an honor. Knowing the great work that we do in the community, there's so many people that are deserving of this award. I just want to thank you so much. And we still have a lot of work to do. So really, I appreciate it. Have a great day.
Thank you to all who nominated Norman for their comments. I would like to return to Dr. Jeff Smith, who has one final appeal to those of you who have not yet donated.
This is the audience participation part of our show. Get out your phone and go to www.comhealth.org/HeroGift or use the web address that is shown at the bottom of the screen. Complete the donation form, but before you hit send, add a bit more. Community healthcare was built and continues to be sustained by our community. Now more than ever, your support is needed. No gift is too small. Thank you for your gift tonight and for your continued support for community healthcare.
Wow, did you realize how many heroes we had in our community? I'm looking at the scoreboard here, and those donations are rolling in, but we could still use your help to support the work that those heroes are doing. We're up over $35,000 now, but we need your help. Again, comhealth.org/HeroGift is how you support community healthcare. Thanks to all of you for helping us celebrate our health heroes tonight. Congratulations to not only the 6 that we highlighted, but to all of the heroes honored by community healthcare this year. Please help us spread the word about what these heroes and community healthcare do to support our community by sharing this video with your friends and your family via YouTube. And if you have not yet donated to community healthcare, please consider a gift of support right now. You can continue to donate at comhealth.org/HeroGift. It's right here on the screen, comhealth.org/HeroGift. Your support will ensure that they can continue their tremendous impact on the lives of so many uninsured and underinsured people in our community. Thank you all again for your support. We've raised so far over $36,000 tonight. Thank you again for all of your support, and have a great night, everybody.